Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
Welcome back to Team Gut Girls, the podcast where we simplify gut health so you can ask better questions, find answers, and feel empowered. Today we're tackling one of the internet's most controversial buzzwords, leaky gut. Is it real? Is it a myth? Is it the cause of all of your bloating, your acne, your brain fog? We want to talk about this.
And honestly, it's much more nuanced than social media makes it seem. Seems like leaky gut is just like this thing. You take one supplement for it, and everything goes away. And most of the time when you might have gone to your medical doctor and asked about leaky gut, they told you that it doesn't exist or it's something that naturopaths made up. And technically, it isn't a diagnosis. But it's actually sort of like a slang term for a process that happens in your body called intestinal permeability. And so if you went in, asked your doctor about intestinal permeability, they may have a better understanding of that, or they may not. But essentially, think of your gut lining like a tightly woven cheesecloth or a coffee filter. It's supposed to let nutrients in and keep bacteria and toxins out, and all the inflammations on one side of the barrier. But what happens is that filter becomes dysregulated. So things that are crossing into circulation shouldn't be, and they're slipping through until your immune system starts to see them. So what this sometimes can look like might be feeling bloated after meals or having a skin reaction to food that never bothered you before. So you might get like rosy cheeks or irritation. Your periods might be worse. So more cramping, more bloating, more intensity. Anxiety, so like feel like I did something or ate something, feel really anxious after, or feeling exhausted, even though all your tests come back. There's a whole bunch of other things you might see. So they'll range from things like having issues with or histamine intolerance. It could be an issue with a particular food or food category. And so we know that, or we believe that the current research says that leaky gut maybe the cause of peanut allergies, where people had an overexposure to something, continue to leak out of their system, drove their immune system to create a response. Immune system reactions are things like fatigue, fever, infections or slow recovery, things like worsening or new allergy symptoms, food sensitivity that seem to multiply, so that snowball effect, poor tolerance to supplements, and even things that we sometimes associate with hormone changes like brain fog, anxiety, depression, irritability. So there's a wide range of things that could be possible, and we'll definitely include a list in the show notes of symptoms people might be experiencing, so you can kind of look through that and see. There's lots of crossover with a lot of other stuff that we talk about. So remember that, even if you're like, oh yes, this totally sounds like me, we've all been here, especially in naturopathic school. We all thought we had every disease when we learned it for the first time. And so keep in mind that this is just information to help you to get some better ideas or widen your expansion list if things that you're trying are not working. It's not a definite, like, this is it. And so you probably are wondering, is my gut trying to tell me something if you're getting all these symptoms? And that's really what we're talking about today.
Mm-hmm. Yeah, so I guess the biggest question is leaky gut, is it a real thing?
Yeah, so the mechanism is real. This idea of leakiness or permeability, there's lots of research on it. We'll go into that later in the podcast about some of the areas that are being researched related to this. But the sort of like a lot of the influencer information that's being out there necessarily, it's not like you have giant holes in your system. It's not that leaky gut is like one disease or one symptom. It's that in general, the research says that the intestinal barrier becomes more permeable under certain conditions that could lead to some of the symptoms that people are experiencing.
So can you talk about what's going on then? If it's not just you're getting big, giant holes, leaky holes in your intestine?
Yeah. So we have these things called tight junctions, and they're little protein structures that are like gatekeepers. So I always think about it when I talk to patients about it like bricks on. And so in between the bricks, there's all this cement that holds the bricks together, and everything's really tight and close together. And when we're seeing more leakiness or more intestinal permeability, what we're actually seeing is some of that cement is like being eroded away or pulled away, or the bricks are separating a bit. And so now, instead of the rain staying on the outside of your house, the potential for it to come inside your house comes a little different. Now, it's a little bit different than that because there's actually a dynamic pathway. And so they actually open and close based on signals that happen in your body. So no different than your eyes open and close, your mouth opens and closes. These barriers basically open and close. They're kind of like gates. And so stress, inflammation, microbes, food, hormones, even like nervous system interaction, they can change, how closed or open are the gates, how fast are they closing or opening. And there's like little zipper seals in between the cells that are supposed to identify things that are okay to enter and leave the system and keep some things out. So larger particles, bacteria, inflammatory compounds, things that we would think about as like food pieces should be kept out, where things like nutrients might pass through because we need them in other parts of the body. So the more tight the junctions are, the more regulated they are, the less permeability that we'll experience. And so leaky gut is really like your gut gatekeepers have been like having a party, or they're like not paying attention. They have a little ADHD and things are coming in and out. So they're not really literally holes in the intestine, but like this intestine that isn't working in a way that we think it should be.
Okay, that's helpful. Yeah. And I guess another point too is when we see this dysregulation, or when things are not when they're not working like they should, we're seeing that correlated with symptoms, digestive symptoms. So yeah. So when people say, your gut lining is damaged, is that an oversimplification?
Yeah. So the gut barrier has all these signals, right? So the signals come from the immune system, nervous system, your hormones, the microbiome, inflammation, the things both above and below where we're digesting and we're doing things. So really like leaky or permeability just really means like more inflammation. And that's a lot of what we talked about, like all these drivers of inflammation, how they change the signaling in your gut. And what people don't always, I think people think like their immune system lives in their lungs or maybe in their nose. Like I don't actually know where people think that it lives. But 70% of your immune system actually lives in your gut. Actually, someone asked me yesterday, like, couldn't we just test the organ of my immune system? And I was like, oh, I wonder what that would be. And so the gut literally is part of the immune system. That's why they call it like the second brain. And so when the barrier becomes irritated or permeable, the immune system's like, well, something's going on in here that shouldn't be going on. And so we get more inflammatory signaling in the body. And so leaky gut may be a contributor to both symptoms, but even disease, but it doesn't always mean that it's involved, but it could be. So when people have experienced bloating, fatigue, food sensitivity, skin flare-ups, those might be things that we're starting to think about could be contributed by leaky gut.
Yeah. And I like that point. And I get a lot of questions about, does this mean I'm inflamed? And so for some people, we can actually see that their nonspecific inflammatory marker, which we all test often, CRP, is high in the blood work. But for a lot of patients that have functional digestive issues and this intestinal hyperpermeability, we may not see that systemic inflammation, but there definitely is low levels of inflammation happening at the gut wall. So, okay, so next question would be, what does leaky gut actually mean?
Yeah. So, I mean, it's a bit about the gut making these little tiny decisions every day, saying like, let this in, keep this out, let this in, keep this out. It's like the airport security, right? You can have 100 mils of liquid, but not more than that. Take your shoes off today, but not in this airport. And so there's all these sort of like restrictions or rules that the gut is following. And when those rules become awry or things start to sneak through, that's when there's areas that become more difficult. And, our barrier really, at the end of the day, is one cell thing. And so when we think about, oh, it must be just all of like layers and layers and layers of stuff, it really isn't. The part that keeps things in and out is actually very minuscule. We can't see it. But it is very small and tiny, and it's not layers and layers and layers like we might think it is.
And I think what confuses people the most is how it escapes, or how things like show up on the skin or outside of that gut.
Yeah. So remember, it's like dynamic. So it's like those grocery store doors that open and close, and because something passes by, it like decides whether to open or close. The same kind of idea. And so, how does things get dysregulated? It's like anything in our body. We have a signal or we have an experience changes how our body responds to things. So our blood sugar becomes dysregulated, or we have a really stressful environment, or we get sick, or we're going through hormone changes, whether that's in the teenage years or in menopause. Maybe we're also having outside contributors. So when we think about things like mast activation, which we talked about in one of these podcasts, or environmental triggers, these are all playing a role in what our intestine does, on top of things like medications, probiotics, supplements that we might be taking, antibiotics that we might be taking. So there's all kinds of different things that are going to affect it. It doesn't mean every time you do something that your barrier gets, disoriented or dysregulated. It just means that, sometimes that could be a thing that happens, whether that's the primary reason you're feeling that you are, or something else.
Let's talk about how leaky gut might even start to happen.
So I've been doing a bunch of presentations on this lately. And so I kind of tried to break it down to like, what actually happens? So there's some kind of trigger, which we just talked about. That barrier then becomes disrupted. And so when the barrier is disrupted and things leak through, then our immune system sees things where it shouldn't be seeing and starts to get activated. So it's like, hey, this shouldn't be here. I'm going to create an immune system response to it. A single immune system response to anything that's not super strong is not going to create this like ongoing cascade of things. But when we get a multiple immune responses on top of each other over and over again, that's when we're starting to see all kinds of things that start happening. And so immune dysregulation, like all of the energy or a lot of the resources your body are allocated to this immune system. Why, when you get sick, you feel so tired, right? You want to sleep longer because your body is taking energy and like redirecting. And so as that starts to happen, your nervous system gets involved. We feel more cranky, we feel more irritable, we feel more anxious, maybe not sleeping as well. Like all those things start to happen when our immune system's kind of taking these resources and reallocating. And so part of what has to happen is the immune system has to clear those things out of the body. And so lots of times impaired clearance can look, for instance, like anyone that gets skin irritation. That's like an impaired clearance response where we get rosacea or acne or psoriasis or itching or even flushing. We might get bloating as an impaired clearance piece because a lot of our clearance comes through our urine and through our stool and through our sweat. So those tend to be the areas that are most affected. And then as that thing gets shown over and over again to the immune system, then we get what's called antigen exposure or antigen response. And so the body starts saying like, hey, every time I see this, this isn't good. It's why you might have been able to eat. I have a friend who ate almonds all of her life. She worked on an account that was like the Almond Board of California. She loved almonds. She ate so many almonds. And one day when she got sick and she ate almonds, her body had this crazy immune system. She's anaphylactic to almonds now. It's literally the person that used to eat the most almonds I've ever known. And she's one day everything just switched and changed, right? So in her case, her immune system just like saw these almonds over and over again because she was hyperfiring. That's why we tell people eat a variety of foods in your diet. So the immune dysregulation is like started attacking it, and that's where we sort of started to see this like hypervigilance, hyperactivity. And so the immune dysregulation means that we lose tolerance to that food anymore, and we're sort of more hyper responsive. And the more of this cycle that keeps going, then we don't have that barrier rehealing and kind of restoring. And so we have this sort of cascade of things. It's not like, oh, the first time I have an exposure to something, I'm going to disrupt my barrier. It's over time, these things accumulate.
It's interesting because leaky gut, you'll see it spread out through many conditions, right? It's not like leaky gut itself as a condition. And this is, this reminds me of the first time I was ever exposed to celiac disease. One of my really good friends, we were, halfway through university, she went on exchange. She got a parasite. I think she was in Thailand. It was a long time ago, and had gastroenteritis. And then at some point developed celiac. She had the genetic predisposition and then lost a lot of weight. And then with that, like there was significant leaky gut or intestinal permeability happening, right? So we can see it in things like allergies and things like celiac and things like IBS.
We saw that post-COVID too. Like a lot of people's immune systems really just got changed. And I have a whole group of people that are celiac and have practiced that were never that before. And so some of the things that you might be considering is already checked off your list, but you've had a tremendous illness or a parasite or something happened between, may change how your body has responded to things that maybe were once cleared. Oh yeah, I fixed my leaky gut before, but then all this other stuff. Yeah. Maybe we'll talk about some of the myths. So one of the myths is like everyone with bloating has leaky gut. What do you think about that?
I think whenever you see things on social media that there's an answer to all things, right? It's really easy to make a post about that. And I mean, I'd love to break this down with the two of you, but we all learned about the 4R protocol in school as naturopathic doctors for every
talk about that.
Yeah. For every single digestion case, reduce, remove, repopulate, reinoculate. I don't know what it is. Yep. I stopped. Deleted it out of my brain. But when we start to think about there's one answer to everything, or everybody's gut functions the same way, we can lose our good question asking and a good history taking with what was your trigger, right? What's going on in your environment? What could have you been exposed to start being more specific about that? But what do you guys think about the 4R protocol?
I think, if it sounds too good to be true, it probably is, right? Like if something is just so simplified to that degree, I just have leaky gut. So that'll, like, if I fix that, my bloating will resolve. Like it is so beyond just that one small piece.
Yes. There's the gut-brain communication, the nervous system, the immune system, all these pieces that we can't just...
Yeah. And one of the things that we'll talk about is just like, how do we approach healing leaky gut? And actually one of the things that is really critical is not adding in those antimicrobials until the entire system is calm, because you'll actually just make things worse and not better. And so sometimes people are really rushing to add in antimicrobials and not doing prep work. We'll see that people get worse, or maybe things don't work for them. And so that's a piece of understanding, like, where's the role of all the pieces of the immune system, the trigger, and all of that pieces. I'd say another thing. Oh, go ahead.
I think that's a good point to make. That if we do too much too soon, it could get worse, because people read about these antimicrobials, or they read about SIBO, they read about these things, and it makes sense. So people want it to be fixed really quickly. I think we're just used to that in medicine. Whereas like telling someone we have to stabilize you first can be difficult, kind of it's just the timeline thing. But so I think that's a really good point to make.
Well, and even just the discussion of like, we need to heal your gut. For a lot of people, it's like, oh, it's just this thing, but it still feels really vague, right? And I think we need to talk a bit more about like, it's very condition specific, right? We have this condition. We need to calm the system down. This is how we're going to do it. And then when we talk about healing, it does mean actually that we're reducing this permeability aspect so that our immune system is not so activated.
And so many of the things that do this also help heal and create calming in a lot of parts of the body. So remember, we're like, even though we're treating one part of the body, or you might see symptoms in one part of the body, the same mechanics work in other places. So keeping that part in mind. Mm-hmm. There's also, as Dr. Dominique discussed earlier, that there's no medical evidence around leaky gut and its relationship to health issues. And one of the things that I sent you guys a couple of weeks ago was that there's this article about type 1 diabetes, and it was a research team that had reversed type 1 diabetes by healing leaky gut in 18 people in a trial population, which is really cool. What are some other things that you've seen or heard in the research about leaky gut's relationship to things?
The intestinal permeability part, or leaky gut part, is part of disorders of gut-brain interaction. So we did one of, I think it's episode, I want to say 3 or 4, which, like we've talked about, is an umbrella term for at least 30 different conditions. And so we're seeing that as one of the mechanisms that lead to very specific symptoms like diarrhea, constipation, bloating. There's many others. So that's one kind of main category that we will see leaky gut in.
We can see it in mood conditions too, like anxiety, depression, because it is like that systemic inflammation, and it can, like, those neurotransmitters and hormones and everything is communicating together. So if the gut is just dysregulated, and we calm that piece, then the communication can be a little bit better.
And if the gut barrier is disrupted, the brain barrier may very well be disrupted, which is a piece of that. One of the other areas that's really growing is this like long COVID post-viral illness, and I'm actually doing a presentation on later in this year at the Gastro AMP, just like how leaky gut and this ongoing illness, virus, inflammation condition is maybe affecting our patients, and how we need to think about that differently. So lots of places that we're starting to see it pop up, and certainly, or maybe not under the name leaky gut, but intestinal permeability is basically the same thing. It's just maybe a little bit longer and harder to say. So maybe we can jump to some things about sort of like some conditions. We talked about some conditions already. I would say there's a few more maybe that we add just for people who are wondering. PMS would certainly be one. Autoimmune conditions, our favorite IBS could be one. Even sometimes people who have difficulty with weight loss or insulin resistance or elevated cholesterol, triglycerides, or food cravings. So certainly there's some metabolic clues that we might see beyond some things that we haven't done before. And so I guess some of the things that might be helpful for people to understand, like, what keeps our barriers open. And so this would be things we talk about in a lot of the podcasts that are like the foundations of health that we need to make sure are in place, regardless of the type of bloating condition we have. If people are under chronic stress or having poor sleep or infections or mold exposures, antibiotics, looked at inside use for pain, or medications for PPIs, microbial shifts, hormone shifts, anything that drives inflammation. And so it's really just about food.
And like you mentioned, it's dynamic. So it shifts and opens and closes, and it's like this system in and of itself. So it's not forever, which is, can not be so afraid of leaky gut and everything, but we can really identify the triggers and what could be keeping the tight junctions open or dysregulated to close them up. And it opens and closes and it can, it can be
Well, and two examples of that is like truly, and like I know I keep going back to autoimmune, but celiac is a good example, is when we remove gluten, 100%, no cross-contamination, we are seeing that hyperpermeability or that closure actually happen. And then we see this person better absorb iron and other things, right? And their diarrhea does resolve. And then same thing with IBS is when we, for a lot of patients, when they will follow a low FODMAP diet, we can see this leaky gut picture decrease where that hyperpermeability literally has been studied to get to decrease.
and quickly.
Yes,
Quickly.
that's a good point. Yeah. The gut responds pretty quickly to certain things.
Yes. Like if you find out you have celiac disease and you stop eating gluten, and within like, I'm sure that within days, within a week, you're like, oh my gosh. But
Yeah. Although like on endoscopy, you're looking at least 6 months. Yeah.
right. Yeah. Yeah. But you will feel better.
Yes, you will feel better before then, hopefully.
Yeah.
So when we're thinking about why these barriers are failing in these patients, we talked about some. We talked about immune system activation, whether that's autoimmune or post-viral. And we talked about mast cell and histamine, nervous system dysregulation, certainly things bacterial and fungi, and endotoxins and parasites and Lyme disease, microbial type drivers, medications, hormone shifts, food proteins, so certainly for sensitive to something, nervous system dysregulation. Anything else you would add to that list? Thing that you think? So maybe we can talk about how would we go about solving this problem first. And so I started to think about it earlier this year and just sort of like, what are the steps that we need to take? And so I kind of think about it as kind of 4 areas. So the first area, which we alluded to a little bit earlier, like stabilize and calm the fire. So we want to like stop the immune system overreaction, reduce the inflammation, stop that mast cell overfiring. And there's research on lots of different tools to use for this. So these are things like flavonoids. So flavonoids can be things like quercetin, luteolin, rhubarb, gismagin, parsley, cinnamon, chamomile. So there's like all kinds of different things in these areas. Saffron, they really help with like bringing in the nutrients to stabilize the barrier, but also reduce some of this like histamine mast cell. The second area in this stabilization are things that help with the mast cells. Those might be medications. They might also be things like vitamin C, magnesium, luteolin, DAO. Some vitamins can help. Butyrate would be falling into this category. So things that are mast cell stabilizing, and then anti-inflammatory like lipids. So we think about things like omegas, SPMs, GLAs. So anything that kind of creates this perfect environment for all of this inflammation to be caught. It's going to be different based on different conditions. So showing eczema, is it showing bloating, is it showing in hormones? The goal, I think, that when we're in practice is try to pick things that help to cover many bases for our patients instead of like giving them more and more supplements. Like if your practitioners are just giving you boatloads of supplements, it's probably helping completely. And so even when we're thinking about this first calming piece, anything to help with our nervous system can help with that. So sometimes that might be mood support medications. That could be things like breath work or vagal nerve stim or getting better sleep. It might be things like pacing or reducing stimulations or making sure your body's aligned with circadian rhythms, eating good foods, warming foods. That's what we TCM, right? Slow eating, calming. So like not everything is about taking supplements. It's also about like, changing the way that you operate. And so many of the patients that I see, and one person that I saw this morning was just like, well, I don't know how to do anything except on maximum speed. And so like she is a prime candidate for having more nervous system dysregulation, having more inflammation in her body, because she doesn't have a way to regulate it. So it's kind of like, so like calming, regulating. Do you add anything else in the category?
Well, it's interesting because a lot of the research is still in the pharmaceutical side of things, right? So when we, compare to the natural products, and so when you look at when patients are working with their primary provider or gastro or GI specialist, they're often given an SSRI, which is the main drug for anti-anxiety. And I have many patients where they do have the comorbidity of nervous system dysregulation, depression, anxiety, and digestive issues. And I have seen great improvement in their gut health when they're actually addressing the brain first. So we can extrapolate a little bit, right? When we work on our nervous system, is we want to make sure we're taking what would be similar herbs that support cortisol, stress reduction, and we can see improvements often in gut health and gut symptoms. It's pretty cool.
Okay, so the second area that I think about is like removing the ongoing assault. So like what is creating the inflammation in the first place? And there's sort of really three buckets that we see probably directly related to the idea of the leaky gut or the intestinal permeability. So one is these like food antigens, one is like microbial drivers, and one is like environmental or internal triggers. And so this might be a place where reducing some foods for a very short period of time may be effective, especially in some of the activity that's coming is from overfiring because of eating the same foods over and over again. This might be a good strategy for like a 2 to 6 week elimination where we're getting the reactive food out, but not overly restricting. Instead, we're trying to diversify the diet. So get people to really try different things and different foods and not, as much as we all love making meals in bulk on the weekend, eating the same thing every day, every week is probably not great. And so the goal is not really avoidance, but it's like tolerance restoration. And so sometimes we have to take out fire to like be able to reintroduce it. Sort of like what you talked about. Gluten case, that case, likely not in reintroducing it, but the gluten's causing the fire. That microbial load category, this might be where, it's appropriate for someone to get some kind of antimicrobial support, but always thinking about it, especially if someone's having this like overfiring immune system, is more like a gentle sequencing intervention and supporting the terrain, trying to like not get Herxheimer reactions or worsen mast cell activation or increase inflammation, because there is this sort of underlying idea that like, oh, if I get a Herxheimer reaction, feel terrible, I must be getting better. That is not in fact the case. Every single patient say more is not better just because this is the dose of paper. If you can't take that dose, that doesn't mean you can't get better. And so sometimes I think that's a piece of that. And in that same category, we think about biofilm, anti-adhesion. There are other things of like why people have this overwhelming load for so long. But it may not even be about that at all, right? It might just be about taking some of the pressure off the system, or reducing exposure environmentally, or things that they are having an exposure to that are changing the medication that may be creating the environment. And then oh yeah, go ahead.
I don't know about you guys, but I get a lot of questions from when we get started with this from my patients in the first few weeks of starting. Because like you said, not everybody can tolerate the dose you're writing down on paper. Start with half, slowly taper up. If you see this response, do this. But there's a lot of questions back and forth often because not everybody has the same body. Not everyone's microbiome is the same environment, or what's going on in your system is the same. So
and it's too, like the dosing can make a big difference, and it can set somebody off, right? If their system is so sensitive. So I know there's a lot of practitioners that discuss even microdosing for those patients that have digestive issues, but they are so significantly affected by, let's say, mold or environmental exposure or other things. And so we'll call it the regular or the therapeutic doses that have been studied in a normal population may not apply to them.
Yeah.
Yeah. And so the last piece of that puzzle is now repairing the barrier. So we want to like stop things changing the barrier function. So we need to like remove those, calm it all down, try to re-support those tight junctions, mucus and interface, the cellular turnover, mitochondria, like all the things that are affected. And throughout this time, we might see people get repeated flares. So they might get increased bloating, they might get more fatigue or more brain fog or more reactivity. And that's sort of what you're talking about earlier, is like when repair isn't tolerated, simplifying the protocol is really important. Going back to some calming stuff, the nervous system, inflammation, cells, it can all be really helpful. And so that can be really helpful for people to be able to get restore repair. So it's unfortunately not one supplement, but kind of a series of things that might make a difference. And they might make a difference in a lot of different ways for people. And so it's not without, it's not like anything that you're going to do will not help. It's that maybe you're not doing some of the steps that you need to think about first. So maybe we can have some practical takeaways for people on what are sort of areas that we can talk about. So some ways that people could calm their nervous system.
Yeah, you talked about some good ones, and everyone's different. I always kind of present some things for people and just say, whatever sounds like you could stick with this on a regular basis, that's for you. So if it is an app that kind of keeps you with this meditation every day, that's a prompt or something, great. If not, if it's deep belly breathing before meals, that's great. Something like that, or slower eating, being present with your meals, walking instead of these high intensity runs, maybe just need to shift into something different for a little bit. Just eating in a calm environment, that can make a huge difference. So just whatever, can be consistent for calming the nervous system is a great starting point.
Yeah. And on that topic, and this is a conversation I do have pretty often, is if we're, feeling burnout with our health, feeling burnout in the environment, people are just doing something all day long, is the opposite of that is actually doing nothing. So thinking about all the things that are on somebody's plate. I know that maybe sounds like simple, but we want to focus on what's our control and where we can create space in our life, because that also facilitates healing.
Let's say number 2 is like, don't jump straight into aggressive gut protocols. There's some things that, even just calming the system, support everything that you need, that you don't necessarily need to have antimicrobials. More supplements equals more stress, things you're asking your body to do always make you feel better. They can actually worsen your symptoms. And so taking something and not feeling good, it's not a reason to continue taking it. I think that you'll just work your way through it. Precision over piling. So if you're getting a ton of supplements, or you're looking at your counter and you can't see the top of it anymore, something is probably needs to be simplified. And I would say focusing on the foundations before restrictions. So instead of being obsessed over cutting out foods, like think about some of the foundations first, which include things like sleep. What else would you go?
Structuring your day to be kind of like what Dawn said. If you need to remove things, that's huge. I'm just trying to find something consistent where your body feels less in survival mode. Go, go, go. I need to do this and I need to do this. To kind of take things out a little bit would be good. So you can get that regular sleep consistency, those meal times.
Yeah. The foundations I discuss with my patients are sleep. It's non-negotiable. Fluid intake. Trying to have some level of, like home cooked meals, right? Where you're making it in your kitchen, where you're nourishing your body, and stress and exercise. Those are the big pillars.
And laughing. That's fun.
Chilling out.
Mm-hmm.
Any suggestions on how to approach this topic with someone's practitioner?
Well, and I think we know this from a different angle because we work with a certain population. So a lot of patients do feel dismissed when they bring up their gut symptoms. So we want to recognize that and validate that. There are some phrases that may be helpful when you're working with your doctor. So things like, I've noticed consistent bloating and fatigue after meals. Could we explore possible digestive or inflammatory contributors? Or even things like, I'm interested in understanding whether stress, sleep, hormones, digestion could be connected. Can we look at some blood work? Even bringing in like family health history, right? Like if somebody has a family health history of digestive issues or autoimmune, and we're starting to see some of those symptoms percolate into this specific patient, is having that discussion too with their practitioner. And then also the person can, have a discussion about focusing on sustainable lifestyle strategies before jumping into more of the extreme restriction.
People will come in and say, okay, I've cut out gluten, I've cut out dairy, I've done all these things. I'm, and they're very regimented and they feel like they're doing it all right. But we can take a step back and make it more practical and, not be so restricted.
Well, and the goal is to not I know we've talked about this before in other podcasts, but wouldn't it be so nice if we can just enjoy that glass of wine or that dinner on a patio and not have to think about it rather than thinking about all the things that we can't eat, right? There's it's the opposite of taking out food from somebody's diet.
Yeah. The guilt that could arise is not helpful.
Mm-hmm.
So quick recap. Today we're busting myths about leaky gut and whether it's fake or the root of every problem.
We learned that the gut barrier is real science. It's also deeply connected to the immune system. So that's why you're feeling the fatigue, brain fog, kind of like little fluey sometimes. And our stress hormones also play a huge role, sleep and inflammation.
And our biggest takeaway might be that healing is usually about attacking your body harder. It's sometimes really about reducing things that are when you're stuck in. So thanks for listening to Team Gut Girls. We are thrilled to keep bringing you more episodes on bloating. If you can believe it, we have at least a dozen more coming your way. Thanks for listening in to Team Gut Girls, and you can always visit the website to see past episodes. We're also on YouTube, Spotify, and wherever you get your podcast. Thank you for remembering better gut health changes everything.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share a podcast with friends you think will want to know more about their gut.
You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.